within the Ministry of Health and Medical Services, Engineer Nahem go for doing this waka for the existing water infrastructure, beginning from the existing water pumped down to the hospital wards and also including Oketa staff houses. The assessment also include evaluating the current water source, infrastructure, water supply capacity, to determine the feasibility of upgrading the current system and ensuring an efficient and sustainable water supply Gol Hospital. This exercise was conducted in the first quarter of 2025 and was made possible with their good MP, Member of Parliament for West New Georgia, and Vonavona for the hospital management. We are working together. Following the assessment survey done, a couple of actions has been done, and through pay in kind and through kind donation. This includes the provision of clean water to Helena Goldie Hospital, provided by the super construction to date. However, there remains a need to increase water pressure for adequately supplying demand lo hospital lo Helena Goldie. In addition, the Soltuna, and I want to essentially acknowledge Soltuna for recently supported Helena Goldie Hospital by facilitating successful negotiation with the Solomon Islands Port Authority for a hybrid solar electric pumping system. This new system aims to replace the current direct pump. So, Mr. Speaker, this will just update him this morning because Honorable Loimilo Kilangalanga and the opposition leader asked him, and I have to update the information. So, me update him now, and this work assisted by the Soltuna, him up to date one. The hybrid system will provide a more reliable and sustainable and cost-effective water supply for the hospital and for the people, Staff Lomonda and around that area, because this area, Mr. Speaker, they are economic in nature, and there are two hospitals that are faith-based hospitals and are very, very important in terms of our economic activities, and one now Helena Goldie and the other one now Good Samaritan Hospital. So these two hospitals are quite important, and that's why we looking private-public partnership lo hospital also image as well. For Helena, Soltuna kicks in. For Good Samaritan, GPOL now look after water system. So I essentially acknowledge those companies that seen these hospital services are important to us. These steps by our stakeholder demonstrate a commitment to improving the hospital's water infrastructure to ensure clean, consistent, and sustainable water access, Mr. Speaker. For other projects, Mr. Speaker, if you allow, I would ask my colleague Minister of Mines and Energy for him also respond to these very, very critical and important questions that appear before us. I thank you, Mr. Speaker.
Thank you, Honourable Minister for Health and Medical Services, Honourable Minister for Mines, Energy and Rural Electrification.
Thank you, Mr. Speaker, and I would like to join my colleague, the Minister of Health, to also thank the Leader of Opposition for this very important question. Mr. Speaker, I am pleased to inform this House that the Munda Provincial Water Supply Project is now being implemented by Solomon Water, and it's designed for providing safe and reliable pipe water for the Munda Township and surrounding communities, including Helena Goldie Hospital. And this involves the construction of new infrastructure and expansion of the current distribution network. So this project, Mr. Speaker, will involve the construction of 2 new boreholes for groundwater production and construction of a new reservoir for water storage, as well as rehabilitating the existing infrastructure at the borehole site, and installation of new disinfection system for make sure that water of us good quality and safe for those who will use him. As well as the expansion of the current distribution network for Kasim now at Helena Goli Hospital and adjacent residential areas. This solar project, Mr. Speaker, managed by the SEWA Project Management Unit, Solomon Water Project Management Unit, and the design and scoping of the works have been delivered under Urban Water Supply and Sanitation Project, so the UWSSP project program. And the work is in progress and it's leading to the need for drilling and testing the water source yields. The funding is, the project is part of the, as I've said, the project is part of the UWSSP action plan for 2024-2028 with proposed program implementation in 2027. However, borehole testing and the sustainable yield and water quality work is scheduled for commence late this month, October, into early November, and him expected to take approximately 6 weeks for this one him done. And this work is currently undertaken by Pacific Strata Limited, while a local drilling company engaged by SEWA, Solomon Water. Due to the changes in the physical location of the sites for borehole and Rosem, some network redesign work is being undertaken by Solomon Water, its engineering consultants, to ensure that the new alignments effectively connect the boreholes, the reservoir, and the distribution system for Sevimna Hospital and the surrounding communities. In parallel, Mr. Speaker, Solomon Water and design consultants are reviewing and finalizing the borehole design specifications, while its safeguards and land team is prepared to conduct follow-up community consultations and engagement sessions in late this month, of October, ahead of the borehole testing, for ensure that the community's concerns and expectations are fully addressed. Following the completion of this borehole testing, Mr. Speaker, final network design and safeguard compliance processes, SEWA will move towards detailed design and tender documentation for the full construction works. However, I must emphasize that the actual construction phase of the Munda Water Supply Project, which includes the infrastructure to deliver clean pipe water directly to Helena Goli Hospital, is programmed for implementation in 2027, subject to funding being secured through development partners or national budgetary support. So in summary, Mr. Speaker, the government, through the Ministry of Mines, Energy and Rural Electrification and Solomon Water, or SEWA, remains committed to improving access to safe and sustainable water supply services across the country. And this, the inclusion of Helena Goli Hospital within the Munda Water Supply Project is a clear reflection of our commitment to strengthening water security and public health in the Western Province. Thank you, Mr. Speaker.
Thank you, Honourable Minister for Mines, Energy and Rural Electrification. Honourable Leader of Opposition.
Thank you, sir. I'm glad to hear the initiatives being taken on the side of Energy and Solomon Water to address this issue. Of course, Helena Goli is going to be a beneficiary amongst many others, local community. Just in terms of the borehole, where Oketa Solomon Water by assessing where now by this borehole have start. Thank you.
Thank you, Honourable Minister.
Thank you, Honourable Speaker, and thank you, Leader Opposition, for the supplementary question. The exact names of local location by me providing them, but there are 2 new sites where SEWA already securing. These are new sites. That's why they require testing. Through the Ministry of Lands, from the Commissioner, already secured not 200 new sites here for doing now the borehole sites here. And that is why, because of the change in the physical locations, some for the network redesign work is being undertaken at the moment. Actual names now may not get him here, but there are 2 new sites. But I will provide him names later. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable Leader.
Yeah, thank you, sir. In view of the fact that by construction start law 2027, Minister of Law Energy say, I come back to the Minister of Law Health, because at the moment we're using one for open well and the concerns raised by Health Minister in terms of contamination of this well is a very likely situation. Have tests been done, or perhaps periodic tests, just to get some assurance as to safety below that fellow source of water at Golo Hospital? Thank you, sir.
Thank you, Honourable Minister of Health.
Thank you, Speaker, and thank you for Opposition Leader for asking supplementary question. Yes, the test time if like for health facilities, we always test that and ensure that I'm free from E. coli. Yeah, so now currently Mifala addressing, which is assisted by the solvent tool. Thank you.
Thank you, Honourable Minister. Honourable Leader.
So tests were done, and how regular are these tests? Them just a one-off test, or because as I understand it, well, he stop a little bit on a bit of a gradient to the hospital, so the possibility of contamination and probably higher. Thank you.
Thank you, Honourable Minister.
Thank you, Speaker. For testing, schedule of testing should be done quarterly to ensure that they be free from contaminations. Thank you.
Thank you, Honourable Minister. Honourable Leader.
Yeah, thank you. Just to the Minister of Law Energy, whether I suppose with the solvent water identifying two fella areas here, although by assessing good water tables and supply those sources, but whether desalination was considered as a feasible source along water. Thank you.
Thank you, Honourable Minister.
Thank you, Mr. Speaker, and thank you, Leader of Opposition, for that important question. With them funding we have available, Mr. Speaker, at the moment we are just looking at construction of new infrastructure and the expansion of the current distribution network. Just for information, with this new infrastructure and expansion, the project is proposed to cost around USD $6.5 million under the current scope of works. However, our options are open. With the assessments and tests we're about to do, we will be able to ascertain if the quality of water available there have enough to provide the quality of water required for those within the scope of distribution. Then we will go with pipe water. But if the testing determines that quality of water have no fit, compromising now health and safety of the people who are using, then of course we can also consider other options, including desalination of water. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable MP for East Later and Leader of the Independent Group.
Thank you, Mr. Speaker. This supplementary question. Me here go 2027. I think if me here wrong, Mr. Speaker. Me that's like a minister for Talankamo for starting of borehole. 2027. PCPM 2027, Mr. Speaker, meeting in this emergency for Helena Goldie Hospital. 2027 and far away for good, Mr. Speaker. If this is an emergency and need to be fixed for Hospital Helena Goldie, I think we should be pulling it back to any time soon. We should start working now, Mr. Speaker. I mean, we just like a minister for Lulukulo this one. If Hemi should be 2027, then I think that Hemtra for Lulu come back for doing now anytime soon. This year or next year or some should start working bohole. Thank you, Mr. Speaker. I have no question below me.
Thank you. Thank you, Honourable Leader. Honourable Minister.
Thank you, Mr. Speaker, and thank the Leader for Independent Group for this very important question. Yes, indeed, water issue agent matalo munda. And that is why work law, these are two phases of the project. First one, expansion of the current distribution network, and second, construction of the new infrastructure. This both of Tuvalawaka are ongoing. As I've said, the testing of the water yield, sustainable yield and water quality is very, very important for Imigarem now, a sustainable distribution system of water. I've also mentioned that, like I said, late October to early November, Baba Imigarem now, borehole testing. The expansion of the current distribution network is an ongoing work, where when I say that the construction by mid-2027 or in 2027, this is the phase where there will be new construction of the infrastructure. But the expansion is an ongoing work whereby I am able for providing water to the hospital even before the construction of new infrastructure. But before we construct the new infrastructure, it's very, very important that we do due diligence in terms of the quality and the safety of water and the sustainable yield blend, so that when we construct the infrastructure, I'm able to provide sustainable services, safe for the users of the water. So we have to do thorough testing to ensure that that construction of the new infrastructure done will provide sustainable and a safe water supply services to the Munda Township, Helena Goldie, and surrounding communities. Thank you, Mr. Speaker.
Thank you, Honourable Minister. I think that disposed of that question. The next question, I think, will go back because it's related to the Minister for Health. I think Minister Honourable Leader of Opposition. Question number
43.
43.
Yeah, thank you, sir. And I do wish to thank both ministers for their responses to that earlier question. Question 43, sir. Minister Blomo Health. Again, favorite Minister Blomi, yes, so. And let me read also. A, how many anesthetists does the country have in our hospital system? B, where are they serving? C, how many are needed in total? And D, what plans are there to increase the number of anesthetists in the health system? Thank you, sir.
Thank you, Honourable Minister for Health and Medical Services.
Thank you, Mr. Speaker, and again, thank you to my good friend, the opposition leader, for the always, as I said earlier on, raising important questions, law areas of health, but also it's an opportunity as well for me to inform him House and as well as the people blowing me across Solomon Islands on this kind of questions. Mr. Speaker, relating to question A on the number of anesthetists that the country has, I think I'm good for me explaining too what na anesthetist, yeah, or what specialty law areas of medicine or field of medicine. Okay, now doctor where got trained for make a man sleep, comfortable, safe, and then before surgeons or the man operate. Yeah, so they are very, very important. Time budget and come for training, so that the whole minimum too. Yeah, no good now. We talk about budget for anesthetist and so what are important too or no more, which they are important in our surgical rooms across Solomon Islands. Relating to question A, Mr. Speaker, low number of the anesthetists that country Garem or country blame Garem and four fala anesthetists who have been trained to masters level, yeah, and one fella hem train or sem post graduate diploma. So in total, imi garem nama 5 fella lo country. Yeah, 5 fella. Relating to question B, loweana or anesthesia or tawaka, there are 4 where the train was a Masters of Medicine level or the waka law. The only national referral hospital below Yumi, where Yumi said number 9. One fella hemi trained was a postgraduate diploma law anesthesia level. Hemi currently work at law hospital lo Kilufi, and apparently him now hemi director law Malaita province law health. Law health. Mr. Speaker, in terms of question C, referring to the number needed for the NRHs alone, we need at least 7 anesthesia or anesthetists to cover the 7 operating rooms below Yumi. So 6 operating rooms at NRHs and 1 operating room recently built low comprehensive health medical center. 7 is currently that what we need, but in the future, if Yumi Garem every operating rooms across Solomon Islands, we need more, Mr. Speaker. We need more for, if we want to decentralize healthcare services and operation, hem take place with the 9 provincial hospitals, Yumi, Hembara needs. So, Mr. Speaker, the planning is coming to increase the number of health workforce. Do accept whether it comes through the Ministry of Education or comes through my ministry. We need more anesthesia and of course other medical officers too. Anesthesia hemi cover for the critical ill patient, especially now if you ask me Talem, if we need to have an endpoint care which we go into a very complex surgery into the future, and by Migarem, very complex ICU, intensive care unit, we need more of these specialties. This means that the minimum we all need 2 to cover the role at National Referral Hospital. We would also like to be able to cover the emergency surgery, as me talem earlier on, lo the hospitals, lo provinces, as Taro Hospital, Sasamuga Giso Hospital, Helena Goldie Hospital, Sege, Buala, Tulangi Hospital, Kilufi Hospital, Aitoifi Hospital, Kira and Lataya. So you may need more of these specialists. When you add all that up, the country needs at least 20 anesthetists, Mr. Speaker. We had for Heidi more, that we need more. On question D, on the plans to increase the number of anesthesia or anesthetics in the health system, the anesthetics department at the National Referral Hospital takes in doctors who are interested in anesthesia as a career and prepares them for postgraduate training in anesthesia. This postgraduate training arrangement is also supported by the Australian Society of Anesthetists. They came in annually to conduct anesthesia training, Loyumi Hospital, and currently there are 6 in the department, NRHs. We sent our postgraduate trainees to the University of Papua New Guinea, Fiji, especially FNU. The numbers that we send are limited by how many institutions can accept at any one time. For example, Mr. Speaker, FNU can only accept 1 trainee per year for anesthesia. So currently, we control 2 all the institutions where we send our students. So it depending on how other institutions were by accepting of the applicants or doctors blame were like for doing training. Currently, 3 postgraduate trainees now in anesthesia who are doing the post-program law FNU. 2 of them should qualify by the end of 2027. We intend to send 2 trainees in 2026. In the meantime, Mr. Speaker, in order to address the demand for anesthetic services in the country, anesthesia is a component of a rural medicine program. So one of the program now we will doing that is being conducted law national University Bloemi Sinu. The anesthesia department at the NRHs will be involved in training doctors so that they can be equipped with necessary skills to provide anesthesia for the life-saving surgery in the provincial hospital. The first cohort of trainees will come into the anesthesia model in the second half of 2025. Me, like for taking this opportunity, there are some registrar number 2 of that trained, and they are posted in our rural hospitals. It's not an easy training, I must say, but I really applaud my doctors who are working there, both in clinics and as well as in the operating rooms. I was one who works as well in the rural areas before standing here. I know the difficulties, yeah? So when you have emergency cases coming on your table or coming in your room, you have to do it. So I really thank the registrars out there in the provinces that can perform life-saving surgeries, and as well as the trainers or the doctors were training over the doctors or NRIs trying to fit into our rural demand for anesthesia. I thank you, Mr. Speaker, and I thank you, Opposition Leader, for question.
Thank you, Honourable Minister. Honourable Leader of Opposition.
Yeah, thank you, sir. Appreciate those responses. Where you mean Kasim 20, where you mean Nidimia, and look also because of restrictions law, training institutions, look also by a little bit wild yet, and so it is probably a matter we must take more control over. Law here, law senior, and perhaps ministry needs to collaborate more closely with him and move past just the rural medicine program into a fully fledged, medical faculty, where population is, sir, 850 now. In a few years will be 1 million, will be more than Fiji, and Fiji is training for the rest of the region. So I think increasingly spaces for Yumilo there by him very limited, and of course New Guinea population him explode now away. So we would have to rely on our own devices on these very critical areas, and the need therefore for senior to really step up. But obviously they would need to be resourced to be able to do that. And so I think the leadership needs to come from the Health Ministry on this matter. Perhaps the Minister could care to comment on that. Thank you.
Thank you, Honourable Leader. Honourable Minister.
Thank you, Speaker. And I take note of the recommendations and essentially acknowledge the recommendations put forward. Thank you.
Thank you, Honourable Minister. Honourable MP for Small Malaita.
Thank you, Mr. Speaker. Supplementary question, Noma. But on this training and development or human resources of this area, when Minister Talem come also which one Noma? Me like also emphasizing Noma one and leader of opposition Talem. It has to be a deliberate and decisive action for training these people. If we are looking at 20 at the moment, we have 5. I don't know how many years they're taking me for training 5 people here. But we will have to make this very fast. Sir, one for a question, but in 2 parts. This will address him also what the urgent cases where we come at clinics and also me worry no more also some of cases of the man die Lord clinic here because anesthetist him no stop man him try to make him but no anyone himself doing me so him die now that one not me like him for Minister, you must address him quick time, and I want to know how we are doing that. I'm not questioning me. The other question is in terms of equipment. Do we have the necessary equipment or the medicine too, and also where or the doctors are using for making man die? Making man die. I'm sleep. Me like Savia, Mr. Speaker. Thank you.
Thank you, Honourable Minister.
Thank you, Speaker, and thank you, MP, for Small Malaita, and also Chair Blohaus, and that's me must answer. Favorite friend Blomi Tuso for play golf. Thank you, Mr. Speaker, and thank you, MP for Small Malaita. Two fala question now you ask him, one fala now, when there's a trauma or agent need law operation, and come law different forms. Time you got trauma, law provinces. You can also use Litnoken, which is local anesthesia, for doing surgery. Me to do him too. I can remove lumps and bumps using local anesthesia. For make a man sleep, lot of big operations now, we have a Medivac referral pathway. When its report is very serious, we follow by doing Medivac from what the province is blaming. So there are ways we can save lives. Of course, there are times that are critical that we are unable to do it, especially if there is a cyclone or that time helicopter no save fly go. We follow by hard for doing anything now. So in the field of medicine, it's important to make critical decisions on a split of a second. Suppose any cyclone no there, you may fly go, but you inside too. Yeah? So we usually have a very critical conversations with the doctors where staff law on side. Now, time you stop rural area, Mr. Speaker, I am good for explaining so that you may have. Me at one point of time, I was at a Good Samaritan hospital. There was a fight, have amputated limbs. Me ready for takeoff time. Me member finish, MP finish, and what I call them, there were 3 people that fight. One fellow actually amputated the upper limb, and we still save them. Yeah, we still save them through compression and then quick referral and other heads. I think our ultimate goal, every doctors out there and nurses or health workers, save life is our #1 priority. But for surgery, they know when to operate and when not to operate. So we will not do all about too. So I hope I would answer the first question. Second one on equipment, Mr. Speaker, low budget equipment staff Lohem. It's an increased budget. I want to thank all of you for the 2025 budget appropriation that you be passing. We still need more, and today by me talk Lohem when there's a question coming on the doctor-patient ratio. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable MP for East Arare.
Thank you, Mr. Speaker, and thank you, Minister, for your answers. Just on the anesthetists that we have here, 5 fella that we currently have in terms of what you answered. Is that the 5 that we have trained, or is that some of them what escape Luimi or to go somewhere too with their skills abroad too? Or, and if that's the case, what now are the issues where what might go for him? We may not carry anyone go out, which is good that you be retaining everybody. Just wanted to know. Thank you. Thank you.
Thank you, Honourable Minister.
Thank you, MP for West or East. Pardon me if me are for that question. The 5 are currently on record where I'm now out of supply. I'm still out of what in below country. For those that are going abroad, I have no records with it. But if I do have, I will provide. But today, when I respond to another question, I will also highlight the retention packages that we have. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable Leader.
Yes, I do wish to. Me went up now. I wish to thank the Honourable Minister for Health. Ini important. You must understand more kita specialist areas. You know, last time on was story minus a true one, but agol blohem Derek Sikua. It was such a doctor. Accident follow road to go say, "Hey, mom, doctor lo de talim nilam." But hey, no way, money no doctor nila. And doctor blow paper no way. So, and that's why important. You must carry motorized doctor who deal with him. Okay, the area also. And I've been wondering if my name here and me come so come Laos. I've been wondering, sir, whether with our friends Law China, of course we have scholarships there too. But the education system law can be much more reasonably priced, whether we can, under our scholarship program, be paying, but or to give him some space. Lol get medical institutions blocked. I had the opportunity to visit Nanjing Medical University, Lo Jiangsu, in June, sir. And Ogata obviously offering me opportunities, and we shouldn't just wait for or to give him scholarships. We should be able to pay for it ourselves. If you need him 20, I send him about 20 will go. Because 20 need blow today, you don't need blow next year. Next year, you will lot young money, you will put him something in it, by population go up. So, I mean, some are all 2 years, but population go up. So, need blow today, not 20, that need will keep increasing. So, I think we do need to catch up on that backlog. And then, but we are able to pay for some of this ourselves. So, even though we're waiting for scholarship. But with those comments, I do sincerely thank the Minister and hard work of him for look forward for improving health services below me. Thank you, sir.
Thank you, Honourable Leader of Opposition. Honourable members, there are other questions relating to the Ministry of Health, and I think if we can dispose when the Minister is still here, I can respond to the other questions. So I'll now take the opportunity to ask the MP for West Parai to ask question number 15, also to the Minister for Health and Medical Services.
Yeah, thank you very much, Mr. Speaker, for giving me this privilege to ask this question as a chair to the Health and Medical Services Committee. Yeah. This question has come into two parts. Question number 15, the health workers and their working conditions. Can the Minister inform Parliament on the following matter? A, how many doctors and nurses are actively posted in the urban and rural health centers? B, what is the working condition of health workers in the country? Thank you, Mr. Speaker.
Thank you, Honourable Minister for Health and Medical Services.
Thank you, Speaker. Mr. Speaker, sir, I thank Honourable Tua Solia, Chairman of the Health and Medical Service Committee and MP for West Kwarai for raising this important question. Allow me to respond to the two questions, Mr. Speaker. Mr. Speaker, for question A, on the total number of doctors and nurses that are actively posted in the urban and rural centers, Mr. Speaker, medical doctors, there are currently 251 medical doctors who work under public service. These include 179 at the NRIH, where I'm representing 71%, and 68 law provinces, and 5 now law Ministry of Health and Medical Service Office. If you may consider Honiara provincial capitals, you may exclude him now Tingwa as urban centers law country blaming, then minimum 95% of our medical doctors actually work in urban areas. And while 12 medical doctors of the Wakalo Guadalcanal province, 10 of the Wakalo Malaita province, Central Island province of the 2 Choiceol 2 HCC, where Yumi Evron comes stop Lohem, hem 11 doctors, Makira hem 4, Isabel hem 2, Renol and Bellona, hem 1, Western Province hem 7, and Temotu hem 3 Fala. So hem now distribution blow doctors blow you me. If we consider all areas outside Honiara, and you may say urban area hem only low Honiara, then 78% of public medical doctors actually work low urban. So different analysis low how you may make them distribution, and then 22% now work low rural areas, Mr. Speaker. Law WHO recommend low doctor to patient ratio every one doctor should be 1,000 population people. For the country, Bloyumi as a whole, even if we include medical officers or the wakal or the private practice of private clinics, Bloyumi lo Honiara, imino kosa hafi mete ratio if we doing fast math calculation. However, for population lo Honiara, with them doctors imi post him, emi exceed him na requirement of 1 to 1,000 population. Mr. Speaker, let me also highlight the nurses too, Bloyumi. There are 1,688 registered nurses and nurse aides are actively posted both in urban and rural centers, Bloyumi, Hielo Country. This includes nurses and nurse aides who are employed by the government through public service. The provincial and also with a faith-based hospital inclusion of Helena Goldie, Aitoifi, and Good Samaritan. Out of this total, 1,097 registered nurses, inclusion of nurse aides, 65% are based in the urban centers, both at National Referral Hospital with 546 nurses. Honora City Council and health centers, Okata Tekemna, the other part, out of the 1,097 nurses. The remaining 37%, which is a total of 591, are posted in the area health centers. So area health centers, the definition, hemna mini hospital. Imigarem rural health clinics, area health centers are considered to be mini hospitals, and then provincial hospital, then imigaremna one referral hospital. So that's the hierarchy of our health facilities across country, Bloyumi. What na WHO benchmark for nurses, low population. So 25 nurses supposed for saving 10,000 population, or one nurse for 400 people, low population. As for medical doctors, the number of nurses to population in Honiara or semi Talem have exceeded minimum requirement by the WHO or NRIH. The same distribution, Mr. Speaker, is true for other health professionals where there is heavy concentration of the health workforce in Honiara. The challenge is, Mr. Speaker, the ministry now for equitably distributing of the health workforce based on service need and workload where Bharavas Takatumas. Some of the common reasons are lack of adequate staff. And I remember very well that the opposition leader had raised into law issue Lo Good Samaritan Hospital about housing for the health workforce, Bloyumi. One of the issues that if the whole couple are married, couple doctors, one fella have maybe accountant, another one have medical doctor, for separate them to fall, another one for Golo province is quite an issue where ministry continue for facing. Mr. Speaker, for respond to question B on what is the working condition of health workers in the country, how many minimum go question them, both one is salary, second accommodation or where of the staff. I have to be honest here, Mr. Speaker, that currently the health workforce falls under 3 categories where remuneration is concerned. This is in addition to what they are entitled to as public service. So some follow working conditions for doctors, Mr. Speaker, under the current Solomon Islands Medical Association SEMA scheme of service, medical and dental doctors are entitled to the following allowances beside their basic salary. So if here come good. First, provincial posting bonuses for under this cadre, Mr. Speaker, have 20% of their basic salary, so they receive it every fortnight. Special duty allowances is 33% of mean salary every fortnight. Multi-allowance, which covers for additional duties for doctors and dentists, 25% of the mean salary. So average salary blogata, then 25% now, actual multi-allowance blogata. Time me ask man, what na multi-allowance is a minimum. So what I say that the multi-allowance is the definition, night duty and what special duties that what have do him and on call and also. Densa allowances too, Mr. Speaker, what this group of medical workers that receive him densa allowance him 390 per fortnight. Yeah, him no go percentage, no para fixed payment. Yeah? This one because no matter you specialized or you intern or you whatever, densa blow medical practice and same across. Deity allowances. Siya waka la hospital barawan fala deti waka through meeting him you what a human being most chemical composition blamey him quite poisonous and toxic and also deti allowances la safala infectious diseases where you may no save but time state of emergency you go ahead touching patient now so deti allowance look at him $390 per fortnight. A retention supplement. Man, what they doing for retaining or the medical professionals blame me. Based on our economy, Mr. Speaker, 25% the one are doing. 25% of their basic salary every fortnight for retention of the health workforce blame me. Transport, Hemi paid $3,000, which they claim it in every one time in every 3 years. So him now what the medical doctors so. SEMA, Solomon Islands Medical Association, only 2 cadres. One is the medical doctors and the dentist below me. For the nurses, Mr. Speaker, for nurses, following allowances have been paid under the current Solomon Islands Nursing Association, SENA, scheme of service. Special duty allowance, 37% of the mean salary. Multi-allowance, 30% of the mean salary per fortnight. Provincial posting, time posting go at low province, $250 per fortnight to every provincial centers, $300 per fortnight to rural health centers, and $500 per fortnight to remote rural health clinics. Densa allowances too, what I receiving, Mr. Speaker, were $390 for every fortnight. A risk and debt allowance for the nurses $390 per fortnight. Housing, Mr. Speaker, very dependent on the public service rental scheme entitlements. And Mr. Speaker, another group of health workers, we call them Solomon Islands Allied Health Association. Under its current scheme of service, it has the following: special duty allowances. Who now? Okay, the Allied Health Association, him now, some of the pharmacists or the lab technicians below me and also. So special duty allowances, 33% of their mean salary per fortnight. Densa allowance, $350 per fortnight. Deity allowances, $350 per fortnight. Housing, again, follow now, public service percentage blocketa. Another one now, cooperative service, Mr. Speaker. At present, there is no scheme of service for this cadre. However, the 2020 to 2021, for the first time, support and cooperative service staff have started receiving the special duty allowances, which is 25% of their mean salary, where they are receiving now every fortnight. I thank you, Mr. Speaker, for all these several allowances or working conditions that they may give him for the medical doctors and our health workforce across country below me. Me wish economy go up more. Me say what a good. Thank you, Mr. Speaker, and thank you, the MP for West Korai and the chairman of Health Law Parliament. I do hope that by work together for increasing the conditions. I thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable Leader of Opposition.
Yeah, thank you, sir. Because me start for look after good doctor, me here list of allowances. A little bit long for a little bit here. But I'm good. You must keep him with the doctors. We must pay them well. And ministers wish for economy grow. You may run a garden, make them collect more revenue, and you may up and pay everyone now. Make them more stuff. Me like sabi no more longo sample doctor o kata wakalo namrain, but then go do in private practice, or maybe lunch hour or evening or semi. Is that part of this scheme of service? Thank you, sir.
Thank you. Honorable Minister.
Thank you, Mr. Speaker. Time opposition leader, you ask me, but I'll smile to for answer question. Not a consultant contract, they are not allowed to do private practice. Yeah? It's stipulated in the contract. For the registrar and go down, they do have that privilege. A little bit hard for monitor him too, yeah. But in our discussion last Friday, when we look into the Health Service Act, which will come to Parliament maybe early or late next year, it's stated there on how to properly create a mechanisms on how to regulate people working in the public sector and then going into the private. And of course, how can we address dual practice license? So these are things that we currently have. I'm glad that you asked it. We are looking into how we could solve that issue. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Any other comments or supplementary question? Thank you, Honourable Leader of Opposition.
Yeah, thank you. Just going the other way around, we have some senior consultants who have got retire or get early retirement, and then go do their own practice. But from time to time, perhaps they're needed in our hospitals to do work. Me ask him under this doctor to patient ratio or population ratio, whether we facilitate those or we encourage it or that happens, and when it does happen, how do we pay for that service? Thank you.
Thank you, Honourable Leader. Honourable Minister.
Thank you, Mr. Speaker. That is what we are thinking when we see the public service bill that has come. We are thinking that time you retire at 55, but we have provision to make them on a fixed term contract. There are good doctors around there that are to retire, but are not strong yet. They are strong with where this can come up. We need to capitalize them. But we need to have the provision that guides us well on how to retain them, but make them in a fixed term contract. So it's in the policy of the new Health Service Act whereby HEMCA. Thank you.
Thank you, Honourable Minister. Honourable MP for Small Malaita.
Thank you. Just following up on that proposal or suggestion or plan, good one, Mr. Speaker. Some lot, doctors no more, but you may lose all money 55, young man no more. So you make him this fella, you speed him up that fella plan, Minister. Question below me, simple one. Me like Save, Tamilu look him, I think 8 or so conditions where Minister you list him come and you may look after what the people, what doctors play. You make good, which is really good. Me happy with this one. Me like Save, what time now you start him this one here? Because Doctor blow me come stop no more. I think 3 weeks then him go me no look him now. Casting this time. Lot of your area health center now me talk about Mr. Speaker. So no would you just make him this one no Doctor blow me go and me no sa when him go. Thank you, Mr. Speaker.
Thank you, Honourable Minister.
Mr. Speaker, this one existing one. Me the serum to Dr. Blue run away. But me sit down this time, but me ask him straight, and then I can inform you of the Parliament. Him should not run away. I haven't. So communication should be reported to the provincial director, then come law ministry. Yeah. So let me find out and we'll discuss him. If him law nyara, then we ensure that him go by. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Thank you, Honourable MP for West Korea.
Thank you, Mr. Speaker. Before I proceed on to the next question, I'd like to take this opportunity to thank the Leader of Opposition and also my good friend, member for Small Malaita, for our supplementary questions where I would contribute to this question. And moreover, I'd like to thank the powerful Minister for Health, Brother Blumi, for the responses which you made to this very important question where I mean regarding now the doctors and welfare, doctors and nurses, you mean. Second question, question 16, the rise of non-communicable diseases, NCDs. Can the minister inform Parliament on the ministry's plan to address the increasing incidence of non-communicable diseases, NCDs, such as heart diseases, stroke, cancer, diabetes, and chronic lung diseases in the country? Thank you, Mr. Speaker.
Thank you, Honourable Member for West Korea, Honourable Minister.
Thank you, Mr. Speaker, and I thank the Honourable Chairman, Law, Health and Medical Services Committee for these very, very important questions that not only affecting our people, but I do have affecting the 12th Parliament as well. Mr. Speaker, with reference to the NCD plans that is questioned before this House, the Ministry of Health and Medical Services is using to address the NCD crisis that we have in the country, that the Ministry of Health and Medical Services has currently implemented. Mifala implementing now multi-sectoral non-communicable disease strategic plan 2019 to 2023. Last year, the ministry revived this plan, and this states me must be enough what people must hear could come outside road there. The latest stakeholder now, Mr. Speaker, we will go one for a ministerial consultation on the 10th of October for follow-up consultation. So the new NCD policy and roadmap by implemented and monitored with all the different strategies, but follow now National Development Strategy, Bloimi 2016 to 2035, and Hemi theme of improving the social and economic livelihood of Solomon Islands. NCD number affecting me too much, and it's of course got some impact on economy bloimi. The National Health Strategic Plan 2022 to 31, a healthy future for all, its implementation, Mr. Speaker, I am guided by this multi-sectoral NCD roadmap with commitments and response from the other ministries to address NCDs. With engagement, low private sector, church, and communities, low NCD activities, there's also a recognized emphasis for non-governmental stakeholders through community engagement, involvement, and collaboration, using our churches as partners in reaching and sustaining NCD community interventions with the provincial health services in creating healthy setting for our people to live healthy and strive for all people, both young, old, women, men, disabled, to achieve their full potential without the threat of NCDs. This is because 80% now, Mr. Speaker, of NCD outcomes are determined by non-health related social, economic, commercial, and environmental determinants that require a solid collaboration and support from other sectors. NCDs, Mr. Speaker, have one for the top 5 causes of death nationally for both male and females in 2023 and now in 2024, based on the Ministry of Health and Medical Services Health Information System. The Ministry of Health and Medical Services would like to underscore that YUMI must work together with a multi-sectoral approach for YUMI address him now NCD and reverse him now trend due to NCDs in our beloved country. For how long we say for YUMI must work together, you as an individual too must be careful of the food that you carry. Yeah? You as an individual, that's how you can contribute to the NCD. I want to say that you must read first time. Look at the packaging materials, look at the kai, read, understand him, then you cook him. You know, take him no buy and eat. Read him first time. If you say that you already have an NCD, if you have a hypertension or high blood, please take him less salt. Yeah? Salt is a sodium chloride. Him go inside blood, split into sodium ion and chloride ion, ion that pushes your blood pressure high. So, Mr. Speaker, involved too, yeah, Mr. Speaker, through you to all my colleagues, that we must be cautious about salty food because the sodium inside can kill you as well. Mr. Speaker, Opposition Leader, good friend, remember a smile at doing health awareness. The Ministry, Mr. Speaker, is committed to establish a society that creates health, enabling environment with a health system that work closely with the community and villages to promote health and well-being through the National NCD Policy and Roadmap 2025 to 2030. We would focus on the following areas. One fella now, strengthening NCD leadership, governance, coordination at all levels, national, provincial, community level, with strong emphasis for private sector, community and church partnership. So leadership, if you me over the man Lohia, member of parliament, you me high blood, but you me still kakai sugar, please not leadership, not just one NCD. Please walk the talk. So all this, Mr. Speaker, with different provisions at community level in improving healthcare accessibility and availability to prevent NCD complications such as heart attack and stroke. The Ministry of Health is committed to improving quality of care towards reducing mortality and morbidity among patients living with NCDs. Mr. Speaker, allow me to make some health tips in this floor of Parliament. If you start having hypertension, Mr. Speaker, not you, but anyone across the country, please reduce salt. Once that hypertension would lead into what they call cardiomegaly, size low muscle low hearts that big, then leads to heart failure, then leads to death. Yeah? So if you want for preventing, time you got hypertension, FM over 135, over 80 or 90, please start reducing salt now. You pre-hypertension. Yeah, so all this, please. If you simply have dizziness, low eye. Yeah, if you have experienced dizziness, number one thing for you check them. Two important things: blood pressure and blood sugar. Yeah, so to welcome with them blood, you must check him. Yeah, blood pressure and blood sugar. Once doctor tell you, hey, sugar a little bit high, you reduce him rice or reduce him high carbohydrate. Yeah? If pressure blue high, reduce him salt, so you must follow. You mean inside the house, the first time first follow. Mr. Speaker, one fella, chairman of PAC, him name is spy when kakay healthy kakay lower. Yeah. MP lo Central Honera. Me look at him lo Henderson Court all over kakay na hot pot. So very healthy. Yeah? So he's leading. I'm trying to emphasize on leadership lo NCD reduction. So Mr. Speaker, with all these health tips, by December 2026, all area health centers in Honiara City Council, Guaracanal, Malaita, and in the Western Province will have 80% of patients coming to area health needing diabetic screening will be screened appropriately. 80% of patients coming to area health center with pre-diabetics or new cases were established, and controlled diabetes must manage properly. 50% of patients coming to area health centers with low, moderate, high risk and active food problems are managed properly with them or initiatives below you, Mr. Speaker. Mr. Speaker, by 2030, I hope that Bami still be the Minister of Health or Minister Wena Bami that time. I'm just making some predictions on our targets. 80% of patients coming to primary health clinics who meet diabetic screening criteria will be screened appropriately. So 80% of patients coming to primary care clinics with diabetes undergo diabetics or food screening or attend properly as well, Mr. Speaker. And 80% of patients coming to primary care clinics with low, moderate to high risk and active food problems will be managed properly. 50% of people with hypertension will have good control of hypertension, Mr. Speaker. Mr. Speaker, with these targets, we aim to prevent 262 cases of diabetic foot amputation per year by 2030, and 165 deaths prevented from disability due to amputation per year, and 2,300 deaths will be averted by 2040. If we achieve 50% hypertension control, Mr. Speaker, we will really reduce and achieving our targets for NCD. The Ministry of Health and Medical Services, in collaboration with WHO, this time what I roll him out now. When we go visit him too, there's a flow for give him good food care. Because we have noted that staka cut leg, and just below your knee there's a calf muscle, there's a calf pump there, which is very important to your venous return to your heart. So you may try for stop him now amputations, low population that got amputation due to diabetes. Time look low wine usually amputate below leg, Mr. Speaker. You must be interested, Mr. Speaker. So yeah, time sugar staka low blood and a little bit heavy. Yeah, so sweet part there below leg, below extremities. So then you have change him na level blow blood. So then you got him na infection. So I'm not say heal too. Me follow wala say doggy, but time me check go, but sugar go up with him 22. Yeah, so sometimes he no doggy, him sugar na kokosi what kind causes of amputation. So the WHO has this very good program of training our people, our nurses at HCC. So I'm really helpful on how to have a good food care. So I want to take this opportunity to sincerely acknowledge the WHO team. Mr. Speaker, on practical NCD initiative to promote health lifestyle, I would like to take this opportunity to promote Walk the Talk for Life. Yeah? So every member of parliament, must lead now. Oh, nara one to gout, yeah? So time uric acid blue high, please you know how fish, you know how staka protein, yeah? Important. Yeah? So staka sickness, if I talk about the Bible of pathology by Mr. Speaker, I will take the whole time, the whole evening. I'm nearly finished on our NCD update because it's a burden to us. The major NCDs concern and diseases low hospital blamina, Mr. Speaker, generally non-infective medical diseases, diabetes, heart, brain and other nervous system are affected too through other NCDs. Kidney diseases too. I'm going for fail. Imi tam garam NCDs, Mr. Speaker. Imi garam too. So even time you garam higher sugar level, I'm also trigger them to formation of cancer. Yeah. So please, imi control of diabetes. We are preventing other forms of NCDs and especially cancer. Law 2023, Mr. Speaker, statistics show that hospital burden, law NRIHs, out of the 3,810 admission, law medical ward agenda, 50% locata, which is equal to 2,149, were male, and 44%, 1,661 were female. 69% of all were equivalent to 3,810 admissions were caused by NCDs. NCDs are heart, related to giving complications to heart, 20%, diabetes 9%, kidney related 4%, brain and central nervous system and 4%, and 1% admission of cancer. Now, what I go through the palliative, supportive care. So now, what the run down low NCD, Mr. Speaker, if you may look here, 69% of admission low medical ward, NCD, and surgical ward, 60% of them were NCD related. The number of sick patients attending cancer day care clinic over doubled by 85% in 2023, Mr. Speaker. The medical records documented additional 2,183 were seen in 2023 compared to 382. It can be a recording issue, but this pattern is alarming, concerning, because I'm increased for good, Mr. Speaker. In addressing the screening pattern of NCD, the hospital, in line with Ministry of Health and Medical Services, basically in 3 ways. One, we will create space, environment, facility, and technology to care and provide for the NCD sick patient. Staff too, Mr. Speaker, we need to increase staffing for addressing over the issues. And thirdly, increasing services and supplies at the hospital. Me coming as a Minister of Health, I always talk about improving the services on 5 pillars. Bloyumi, Mr. Speaker, it's already in crisis. I urge all of us to work together to combat the NCD rise across the countries, and I want to say, please, the food, yeah? I can be the custodian of the Food Act, but I want to ask all across Solomon Islands. For North Guadalcanal, Mr. Speaker, we are increasing production of agriculture kakai, yeah? There are 12 economic zones. I bought 12 tractors for increasing because food security also affects him now. NCD, because of no enough kaikai, local kaikai, people tend to process food which are much cheaper and affordable. So after 9 months, I'm expecting agricultural foods will be available Honiara with an affordable price. So I am, as a Minister of Health, I bought 12 tractors, Mr. Speaker, to address food security that related to NCD, because I'm tired of seeing patients in the clinic that comes with NCD. So bear with me. It's not a miracle, but it's going to happen. That time lo weekend me here at economic zone blow me present me happy because the number of gardens that are working, yeah, that will contribute to the food security blow me lohoniana. Once again, Mr. Speaker, I thank you, and me thank you, member for West Honiara and chairman, for asking this very important question. Report blame, I will ask my team. Comprehensive report, make me run reread. The summary now me give him to us in this honorable house, but it's good to have us read. So me upload him savala bara practical kai healthy kakai. We were there once, Mr. Speaker, and they said, "Hey, are you eating is it grasshopper kakai?" But it's a healthy one, a healthy food. So once again, Mr. Speaker and my honorable colleagues, I wish I responded well to the question that put before my ministry. Thank you.
Thank you, Honourable Minister. Honourable MP for Small Malaita.
Thank you, Mr. Speaker. Thank you, Leader of Opposition, for giving me opportunity. First time, I want to thank him. And Brother Blomi, everyone here, me well related, no more. Leader of Opposition and Brother Bloem. Man ask him question, I think 12,000 too, so me related goal him to you, Mr. Me happy lo one where Minister Hamitalem and especially by him make him also me rereading more something. Problem lo you mean no man him cost lo bedos him for operate night this one reading. So you make him come quick time, Minister. And this whole idea, hey, by you call suppose him take a more portfolio lo agriculture, and me a little bit right. But nice one, yeah. That one, no, Mr. Speaker, me like him for me feel like copem lo him. No, or not something, but how him do him low constituency lo him. Because time me hear him come, me go look him too, yeah. Go follow him road, you look him no more farm lo him. So me like for encourage him, Minister for him. That one not for teaching me vala. Kai, hey, you teach him what money and nothing gonna follow me. Question blow me also in law side law. I think the minister is going ahead with him addressing this one, and I take note. I think one fella start reminder me tell him long the situation is already in crisis, and all is related to food no more. So treatment and clinical services, no me like a little bit, that's like me like Save, longo plan for creating space and all same. So meeting about space also, maybe beds and place for go admit lohem and also no me like Save. Imi Garem place because this one year Embara was taka people now, lo say 60% over now. Every bed lo hospital ya NCDs no more. So me like sabe whether we have that space for all get a minimum space different from normal hospital, Mr. Speaker. Thank you.
Thank you, Honourable Minister.
Thank you, Speaker. Space for particularly designated for NCD complications, no more, Mr. Speaker. Yeah? So, by you looking law surgical ward, or semi-talent percentage, complications law, or no more occupying the bed space. Yeah? So we still don't have it, though we have an NCD center where Hemna law Kukum, but I'm for daycare. Thank you, Mr. Speaker.
Thank you, Honourable Leader of Opposition.
Yeah, thank you, sir. These are very alarming reports indeed, and therefore our response must also be very, very significant and serious, and because most of it is in food, of course, Narasailan, exercise and other aspects of life, lifestyle. But lo side lo KKE, labeling law at KKE. Samvala packaging law get processed food here, you no sabe read because I'm no some other language, I'm no pidgin or I'm English. So, but I many people blame me, look nice, so tak them go no mono, all same. But I do remember that law with regulations. We do have a very thick food set of food regulations here, and so obviously enforcement is an issue. So perhaps the minister could update him how now enforcement and what now constraints where you face him and challenges where you must address him, both through budget but perhaps even for strengthening that regulatory system. And my second question is with regards to the Endlo Datfala question, Lo West Kwarai. Can you ask about chronic lung diseases in the country? Lo Endlo question, substantive question. And me no heren response where me for ansam side lo lung diseases. Thank you, sir.
Thank you, Honourable Minister.
Thank you. Honourable Leader of Opposition, talk about voice out. Just on the enforcement law food labeling, there are a number of players here. Before him interim come, we should have the SPS requirement, law. So which is not under my ministry. And time him come now, excuse me. Time him they have the requirement for SPS, so I must be colleague Blomilo Ministry of Foreign Affairs by helping me for answer in terms of accepting the Naralangus time start. But if all man say read him Chinese, I'm good no more, and if I read. Of course, one of the weaknesses inside law inspection law, the food that over our counters now, workforce, not that department. At one time, I have already recommended to increase the enforcement team, both for tobacco and other food, At one time, there's a report that sent to me, so we will actually go to store for repackaging the chicken. So we are working by looking that there are some water to we will start for closing. So we are working, but we have very limited workforce law, that space of inspecting and compliance to our regulations. I will ensure that we will by improve. Ministry big too much here, but we will try our best on how we could fix the gaps that we currently have. The number of retails here, but outnumber two, or the number of inspectors, law Mifala, law Ministry of Law Health. Second one on the chronic lung disease. I don't have the numbers with me. On your question on the chronic lung disease, what I call them COPD, there are some. I am start for kakamap too, what a chronic lung disease. Even myself, I have what they call reactive lung airways. Sometimes you got them trigger me too. So sometimes me go lay down with them everyone in the hospital no, for find them oxygen. Yeah? I'm not very shy away to say this. It is because of the air pollution, number of vehicles and start increase the town blaming. So we are exposed to some of the heavy metal, but we don't have the exact numbers that indicate, but there are symptoms of chronic lung diseases. One now, chronic lung diseases, also one major risk factor now is smoking, and I would want to say that smoking has not only affects your lung, but also affects the metabolisms that also gives rise to insulin resistance, where affecting the regulation of blood sugar. So, smoking now, one fella, goes up everywhere, man smoke no more. Though we do some, we have the regulations to look after it, but it's also challenging to really go on a door-to-door inspection, Lord man smoke. Time me work as a medical doctor, me looking more at the beginning where cough. First question me ask him, Mr. Speaker, is daddy smoke too or mommy smoke too? The answer is almost yes, yeah, man. So I told them, time you smoke, you go out. Yeah, so passive smoking is also another one. You man used to stay close up, lot of man smoke, please stay distance away from them. So smoking is another issue where you may look in low country. I think one fella boy will have come publicly. I really sincerely acknowledge him that me baro come out of Facebook. I call him Solo Boy, trying to tell about smoking, on how he enjoys his smoking, but then he got him some issues low lung. Me quite acknowledge him his bravery on campaign trying to promote healthy life in terms of lung diseases or chronic lung diseases you may call. Once again, Speaker, thank you, and I thank you, Honourable Opposition Leader.
Thank you, Honourable MP for Central Honiara. You have the floor first.
Sorry. Thank you, Mr. Speaker. Meeting in question Blumia, but I'm go time in money read go him dismantle straight now. Yeah. Thank you, Minister, for that very, very excellent presentation that you put him out come here. How we are going to address the rising incidents below NCD, low country Blayumi. And thank you to Member Blowest Kwarai for registering this question. Before I come to the primary question, me, Member Blow constituency Blomania, Minister, every night no more people come asking me for transporting motor Kamlo hospital. Either Goro or Kamlo hospital. So I think he'll need for work hard a little bit. What a cassava in the plant, I think him, but take a little bit time more for Baba help for sort him out. Now the careless behavior that other people Blayumi got him this time no consumption of the food where you got him there. Last week me order him tractor blue too for come plow him place Blomilo there for plant him cassava. So me encourage him to follow the project that SAPE am doing. I think it's really leading us to turn our attention away from what food ban, but really causing what NCD law contribute me. And also say this week, last week here, there's blow the relatives blow me, but I'll continue and then even longer Central Honiara too. Emotion. These are the things that me like for Harim Lu. How number by you me addressing the immediate and then you may go for long term. What are the equipments that you may send them below the people, all the rural clinics here, rural hospitals here, so that the people are aware of the seriousness of disease here. Emotion. Are we resourcing them? Come the question we like to ask him, we are very relevant to this primary question, West Korea. And if we don't, why not? Amos. Because by every now and then, Baba, you become lawyer, read him over the essay, tell him everyone, let's do this, do that. But what are we doing to raise the awareness lower the rural areas here? Bring the right people down low there so that they are closer to our people lower the rural areas, and then raise the awareness of the danger, the risk that this will NCD government society blame also. Do you think that we are putting the right investment in that area? And then maybe in the long term, Mr. Workload increase him now, side of primary health education along rural areas. What's your take on that, Minister? I'm no more, a little bit small question, we like to ask him, not primary question. West Parade. Thank you.
Thank you, Honourable MP for Central Honiara. Minister?
Thank you, Speaker, and I thank the member for Central Honiara, and also thank you too for assisting more the people for transport law constituency of Lomi, because you stop one law there before you member of law Central Honiara. And also I want to take this opportunity to acknowledge the member for Central Honiara as well, and other members of Parliament that continue to be part of this mission. Him by him to follow bus for Honiara City Council. So I really sincerely acknowledge him for those buses. I don't have the opportunity at that time he come out law media, but I acknowledge him now. For in terms of rural areas, yes, the number of dates are increasing, not only, I guess, to the Member of Parliament for Central Honiara, but also for myself too. We have been experiencing request of coffee has been significantly increased in this recent time. So that rate, blame but will go up. One thing that is recommended by the PAC chair is the community health awareness. Indeed, it's one thing that we should do. I proposed within the ministry for Imi Garemna community health workers. So planning is there. We start looking around it, talking to our donor partners on how we could have community health workers for staff lo community Bloyumi. Once this plan is come to fruition, I will be pushing it, Mr. Speaker, and so that they may start him next year. So it's an idea of having a community health workers, rural areas that can do simple diagnosis, like diagnosing blood pressure, then doing counseling, make them check them blood sugar level, then say you diabetes or you got a sickness sugar, then start them with treatment. So those are some of the initiatives, and of course during public health time, also make them awareness law NCD. Me really acknowledging the fact that we are struggling to address the NCD at this time. But we are not ignorant to that challenge that's coming on our shoulders. So we will continue to make changes, make initiatives, and it's good to hear some of the good recommendations coming on this floor of this Honourable House, Mr. Speaker. Thank you, Chair of the PAC, and I thank you, Mr. Speaker.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Speaker. Question me like to ask him, I'm now Central Honiara, I ask him, but me got another one. I was going to say this fella ideal or awareness here. Very important to us, Mr. Speaker. But he may do it properly. Me minimal sen. He may make him, but me make him also. He may say several context and. Me tell him this one, sir, because one of the program where I think what will health or now do you mean one for song, yeah? Song what go make him lo what pastor blom you holo sikos or what they not sing him. What sing him, but me fala lo what the word lo song, yeah? I'm good for message about what the word lo swear, yeah? Yeah. I mean, me no like tell him so word, yeah, no. So whatever happened, what pastor, or put to more under discipline. We know how many week or month. So that when now, in supporting one where Central Honiara and Tale, you must make them awareness, but you need to do him with them. You must have a tool or the kind of something also you do him. No, go to me. What language blow you me too? What language blow you? And language blow Central Honiara? Or some people swear word, but a good one look at now. You must have a look at him. No one will mean. No good for message. You got talent, look at man where you awareness, let me will fight now. Question blow me also. I think this whole situation where minister report them come to crisis situation and like leader of opposition and tell him, hey, you mean desperate too much, yeah? So I was wondering whether this is a policy question which probably Prime Minister might like to respond to. Law side law legislation and the minister is saying Karim para difficulty law implementation and policing law existing legislations like this one, smoking. Yeah. I'm hard to myself, sir. But me like sabe whether him inside law dictating blongo policy thinking law government, if look longo ban him what a kai where label blog at I mean also redeem and no dollar. Sir, meeting him we must make him more some drastic actions law addressing food where have now caused long disease law you mean. And making people die, making me suffering. I think the costs were related to medical attention and on several diseases, yeah, and probably me overcome and me win him. Or get something where me get him out long food where him no good for us. So I was just wondering whether inside law policy thinking of the government anything law side there. Ban him, make him legislation for banning some fella Claude Kai. Thank you, Mr. Speaker.
Thank you, Honourable Member for Small Malaita. Honourable Minister.
Thank you, Mr. Speaker, and I thank the Member of Parliament for Small Malaita for raising important remarks or questions and recommendations. Take note to the total ban. I will go back to the ministry and see what we can do on some of the foods as per the Pure Food Act, Loyumi. I take note of your recommendations on this floor. Thank you, Mr. Speaker.
Thank you, Honourable MP for South East Choice.
Thank you, Mr. Speaker. In terms of strategic or specific strategies, from discussions, obviously the emphasis should be on primary health care. You may get a specific. You may say doctors go or students will go train in Cuba, Mr. Speaker, and the plan there is for Cuba got one of the best primary health care system in the world actually, and so you send students go there. Some of the doctors have come back. They posted throughout the country for addressing before what even come for testing sugar, something also what must not come now. Even addressing so they know how to look after themselves. So before you even come to clinic, that plan was to address that. So what not even come. So you may address him at the primary health care stage and also. So what has become of that fella, that whole program? It means that sending people go there more or no more now. That whole program finished now. Mr. Speaker.
Thank you, Honourable MP for East Choice. Honourable Minister.
Thank you, Mr. Speaker, and thank you, Member of East Choice, for that question, whether we continue to send students to Cuba for medicine studies. But let me acknowledge him for his leadership then, that over the Dr. Sublimigo law, Cuba, remember that himself, primary intention, everyone go to Cuba for primary health. Yeah? And I said, indeed, it's true, but when they return, we also need them The numbers, as I said, in the doctor-patients ratio, are quite low. I met the ambassador of Cuba coming to my office last year. We also explore our continuity of sending our students to Cuba, but it is essential and important to revisit the intention of that one for primary health care, which is very, very important as alluded by the MP for East Choice. I thank you, Mr. Speaker.
Thank you. Honourable MP for East Harare.
Thank you, Mr. Speaker, and thank you to West Korai, Chairman of Health, for asking this for a question, and thank you to the Minister. Busy morning for you in terms of informing our people and this Parliament. Mr. Speaker, as you sabe, ako tabu blayulo ararea. Time what drink tea, sugar pot, what putum, then ako say osem, you cut seleva. Ako give him come sugar for you, then ako say you cut seleva. I'm also one for a joke blokata, but time me lo them is him no joke here. This one here, you mean me make funny molo. Something where no good you mean I end up in hospital look at Katia. Kind of so. So I think awareness, is very important in terms of that. And I think that's a policy issue to hear that government biting about. I mean, we think of partners for a specialist hospital here, which is needed. But that is at the end blow kind type. I think it's also good to also look at the preventive aspect of it, awareness. Them down now, people like come at the specialist hospitals and such. And Mr. Speaker, sir, when you visit overseas, lot of Asian markets here, when we find them now, is that the old canned food where we used to get them here, everyone full up there. But me no find them over now, got the shops blame here again. But the time you go over the Asian supermarkets outside, everything is there. So I'm wondering as well in terms of the policy, once again with standards, labeling, and all of that. Me lucky no more, Mr. Speaker, say me got Google translation lo phone me. Sometimes me go lo store, me borrow camera go na, they me reading lo English. One em now that all language em talem come here. Fit for me KK mo how. But not everybody has access to any kind of nice phone or sem stakalo lo here garam here. So I think that's also an issue that we need to protect and people blame me about. Mr. Speaker, sir, question me no more. In terms of the affordability, and me hear him a little bit, Honourable Minister touch and finish. I think the idea of affordability of local food. I keep hearing about people like him that one, but cost here now am high. So when it comes to opportunity cost, I think economics come in and they go for the instant things. And then they miss out now the nutrition in terms of one M now Minister try for doing with the constituency blame. So my question here is, what's the policy? Are you going to be putting in place price control issues for local food, or are you going to let the market determine pricing and you're working on volume? I just wanted to know in terms of what I'm thinking of government in terms of this. I think it's an important piece of what we're talking about in terms of what we're trying to address here, Mr. Speaker, sir. Thank you.
Thank you, Honourable MP for Mr. Harare. Honourable Minister.
Thank you, Speaker, and I think Member for East Harare for the question. In terms of price control, I don't have the mandate. It's supposed to be the Ministry of Commerce and Industry. If they could have that legislation on our local food. But one thing in terms of affordability is, that it's based on supply-demand cave. You just increase the supply and, of course, by a price drop. So it kicks in with the affordability and then availability rule. Yeah. So that's what I'm trying to do. Trying to increase the production in my constituency, and of course, if it could have an impact, local markets, Mr. Speaker. So thank you, Mr. Herrera, for your question.
Thank you, Honourable Leader of Opposition.
Yeah, thank you. Time is Harare to talk about Google Translate now. Thinking because there's probably a need for an app developed for Yumi, where this time everyone on Facebook and smartphone and also they could take a label and look him go. But instead for him translate lo English no more, Hem talem steret no, this one by you hat attack lo mo, this one by. Osem cigarette time you go buy packet cigarette, you look him go borrow manwe mouth blem cancer kay finish or like no like lung or also. So maybe something to, you know, further inform beyond just the translation. You go buy 2-minute noodle, hem sob na high blood pressure or something also. But you know, it is a crisis. You know, if 70% low admissions, law number 9, hemi NCD related. We're not sure about the deaths. We didn't get that statistic, but the deaths would also be a higher statistic. We need to be on war footing here, Mr. Speaker. We need to declare war on NCDs. This time you may know bara wasem lo war footing yet. And time lo war footing, you may take him some drastic decisions, include him also small mala he said today. Huh? Oh, hey, sorry. Remember small Malayan said today that you may ban him noodle here. Even salt here, ban him. Sugar here, you may. We need to get on a war footing as we confront this problem. It really is a serious problem. You may laugh lohem, but you know, I'm no laughing matter. Mival all get pirate here. You saw time mival putung koi ragal of air. Mival inside ketole full packet sugar and inside here. Then you just top up water no more. But mival me make fun of but man, stuck man no me die no more sugar. And I think that's, you know, right across lo country me take light follow him. But I think this war footing idea, no me like a ministry thinking around. If we get on a war footing, what would be the desperate measures we would need to put in place? Then let's consider those. Are they too desperate? Or are they desperate enough that we need to take them? Perhaps Prime Minister could express a view on this. So we take this matter really seriously. It affects the economy and productivity, as well as well-being, social well-being, below communities, below Yumi. Thank you, sir.
Thank you, Honourable Leader. Honourable Prime Minister.
Thank you, Mr. Speaker. A number of policy-related, very important questions and comments have been raised. And I do thank the Minister of Health for the detailed responses that he has provided to the main question, but as well as to the supplementary questions that have been raised. As far as policy is concerned, yes, we have one of the 4 pillars of GNAT's policy framework is the human capital development, and that covers health and education, the well-being of our people. In terms of health, yes, we face a crisis in terms of the NCDs, as we have heard from the Minister. There are existing legislations, and I think those legislation needs to be amended as well, as far as they relate to food imports, issues of compliance, probably. Coming back to primary health, yes, there is a need for us to invest more in terms of awareness in our rural areas. Some of these are choices by people, policy, not policy, but choices in terms of food, in terms of drinks. But I think that sustained awareness in our rural areas, as Central Honera has raised, is an important point, and one we will work closely through the Ministry of Health and other stakeholders that we can address, manage these crises. Not only water sickness where I'm covered the question, but we also have malaria, and this is also another area, increasing incidence of malaria. The Ministry of Health is working to revitalize the malaria roadmap that we had before, and then Ugo malaria hem godan. This time we are among the highest in our sub-region, Papua New Guinea, Vanuatu, and Solomon Islands. Solomon Islands and malaria incidents and go up more, so we are facing a problem in that regard as well. As a matter of policy, yes, we have policy frameworks in place, and we will look into detail as to what specific programs that we can come up with, including for primary health care, including awareness, but also ensuring the necessary legislations in this area are amended so that we can address the current situation that we have. Thank you, Mr. Speaker.
Thank you, Honourable Prime Minister. Honourable MP for West Korea, conclude your remarks.
Thank you, Mr. Speaker. Me like to take this opportunity just to thank those who have contributed to the question, especially for the MPs where I would come up with the supplementary questions, brother. Where we make him Minister for Health, me fully answer him now this fella primary question. And lastly, me like to thank him, Minister of Health, for the well-detailed response where you give him to the primary question. And with that, Mr. Speaker, me sit down.
Thank you, Honourable MP for West Korea. Question number 59, for the MP for Temotunere to ask the Minister for Education and Resources Development. Honourable Member.
Thank you, sir. Yeah, question number 59, Hemstan against Neblomi, entitled Logging on Wemapuru National Secondary School Land. The question reads, it has come to attention that part of the school belonging to Wemapuru National Secondary School is currently being used for logging. Can the Minister clarify who granted permission for the logging activities on the 84 hectares of land belonging to Wemapuru National Secondary School?
Thank you. Thank you, Honourable Member. Honourable Minister.
Thank you, Mr. Speaker. I wish to thank the Honourable Member for Temotunende for raising this important question, and I'm pleased to provide my response, Mr. Speaker. My ministry was only recently made aware of the allegation concerning a logging company that is said to have encroached upon the land belonging to the Waiapuru National Secondary School. According to the information that my ministry received from the Makira and Ulawa Educational Provider Office, a meeting was convened on the 22nd of September this year between the provincial executive and the Waiapuru National Secondary School management to deliberate on this matter. The area of the alleged encroachment is believed to be within the lot 2 of the LR 817, the title which is held by the Commission of Lands. For information of this Honourable House, Lot 1 is under the jurisdiction of the Temotu and Makira premiers. A survey was subsequently being made or conducted which confirmed evidence of encroachment. And this encroachment reportedly occurred following the invitation of an illegal settlers into the area. And these settlers are believed to be the descendants of the late chief of Kaunasogu, who had transferred the land to Temotu and Makira provinces around 1974 for a payment of $10,000. Mr. Speaker, one of the key resolutions that from the meeting held on the 22nd of September between the school management and the establishment of a task force to address the land issue. The task force, which is chaired by the Deputy Provincial Secretary for Makira and Ulawa Province. It was further agreed during that meeting that a brother of the late chief of Kaunasogu, together with a close relative, will be approached as members of the school board and of the specific committee that is being established
to deal with the disputed land. This inclusive approach is intended to facilitate the constructive dialogue and to ensure that the said land or the issue is to be resolved amicably. The brother of the late chief, who is the only surviving member of those who originally granted the land, continues to advocate for Wamapuro National Secondary School to reclaim the ownership. In addition, a representative from the One Raha trustees will also serve as the member of the task force that has been created, and the provincial legal advisor of the Makira and Ulawa province has been directed to take necessary legal steps to address the encroachment, including the filing of the application to hold the KS Logging Company bond with the Central Bank of Solomon Island. Furthermore, I have been advised that the Deputy Provincial Secretary has been tasked to conduct a land and environmental assessment of the logged area within that lot too. Mr. Speaker, the action that has been taken so far have focused primarily on the establishment of the task force and the creation of the shared understanding among stakeholders regarding the land in question. My ministry at this point in time will continue to work closely with the Makira Ulawa education provider and the principal of Wamapuro Secondary School to monitor the progress and to provide further updates once it comes on hand to this particular matter. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Thank you, Honourable MP for Honourable Leader of Opposition.
Thank you, sir. May I like ask the Minister of Forestry whether this any sufficient grounds for suspending license for this logging company, and what steps have been or are being taken to effect that. Thank you.
Thank you, Honourable Minister for Forest and Research.
Thank you, Mr. Speaker, and thank you, the Leader of the Opposition, for the question. Yes, one of the common problems within logging now is trespass. We have companies who are encroached into customary lands. In this particular instance, it's the unregistered land. And there are processes under the Forestry Act where may provide for licenses issued for customary land. If it is a registered land, any different process under the Land and Titles Act, you need a grant of profit for that. So in this instance, if there is an encroachment law registered and owned by the Commission of Lands, two options are available. One, go to the court for restraining orders. That by taking a little bit of time. The other option is to write to the Commission of Forest for issuing a suspension. And thereafter, they can appeal to the minister, where determination by the minister and final and conclusive. So, of course, it's a registered land, there's encroachment there. I mean, easy too much for identifying it, because there are boundaries of the registered land here. So if there is evidence to show that there's encroachment, appropriate body should go to the commissioner, and commissioner should straight away issue suspension of the license. And then they have the right to appeal to the minister within 2 months, and the minister's decision shall be final and conclusive. Thank you, Mr. Speaker.
Thank you, Honourable Minister. Honourable Leader of Opposition.
So on this matter, sir, task force by take time. Today, no more minister should write Golo, or PS should write Golo, Commissioner of Forest, to suspend it, license, then leave him out appeal of minister, the minister of whom Kabania now. encouraging this kind of nonsense also. In the meantime, of course, PS, law province and task force got look damages. Or must pay come back to school for logs or got taken finish and for the damage, law trespass and also. But I'm just concerned that you may do him task force and then also more by take time, and by the time you do him, every log out, company out, no sa holem now. By also more 33 shipments law and only mona. So immediate action is really required, and the commissioner needs to act this week, no next week, this week, or suspend him license and take some punitive measures. Thank you, sir.
Thank you, Honourable Leader of Opposition. Honourable Minister of Education.
Thank you, Leader of Opposition. Thank you, Speaker. Yes, exactly. Thank you for that advice. I will talk with my peers and my SMT to look into that, and if that necessary, we will take that approach so that you may follow the Forestry Act and also what is necessary, while the task force will continue with the deliberation and come up with what's the final outcome. But we will see into that. Obviously, thank you, sir.
Thank you, Honourable Minister. Thank you, Honourable MP for President Georgia. Honourable.
Thank you, Mr. Speaker. Supplementary question one to my good friend, the Minister. Is there any ministerial policy or guidelines that allows or prevents private commercial interests to carry out commercial activities for profit in law areas like a school land? Any guidelines to either to allow or prevent? Thank you.
Thank you, Honourable Member. Minister for Forest or Minister for Education, Minister for Forestry. But that's an option with a window where that can be pursued.
Thank you, Mr. Speaker, and thank you for the full question. The law is there, process the law and we're there. If there is no option for that, that means an unlawful. Thank you.
Thank you, Honourable Minister. Thank you, Honourable MP for Temurune. Do you have any comments or supplementary questions?
Thank you, sir. Thank you, Honourable Minister of Education, for your response. You will be telling that recently, but this one happened long time. It means that this fellow school, no one will look after me, though it is a state school. Big land for good, 84 hectares of land. Lot 1 na school staff land. Lot 2 na on top of Busia. And Kokoaya ko sab out na, lot 2 ya. But thank you for the response. Your response today him clarifying some of the doubts of the current and former students of that fellow school. Your response today, not for me, but for the benefit for the people of this fellow country, most especially those who are educated in this fellow school, a state school. Me like to say that this fellow state school and forgotten school here. That's why if I just say what now happened in school here, the Minister of Education have to ensure him look go check him school here. Him no claim that him on but him no say go visit school. No casting San Beach then run away. With that, thank you so much for the response.
Thank you, Honourable MP for Temurune. Honourable Minister.
Thank you, MP for Temurune for the question and also for some piece of advice so that we will make sure that that school where Puru must be well taken care of. Thank you so much.
Thank you. The last question for today is a question number 61, and for the Minister for, Honourable MP for Ismailita. The Minister responsible is not here. Can we put that question off until the Minister is present? Thank you. So I think that concludes our proceedings for today for the questions and answers on the questions. Thank you. Honourable Prime Minister.
Statement of Government Business for the week ending Friday, 17 October 2025.
Thank you. Honourable Prime Minister.
Thank you, Mr. Speaker. Statement of Government Business for the week ending Friday, 17th October 2025, Monday, 13th October 2025. Bills Bills first reading, the Public Service Bill 2025. Motions, motion of adjournment. Tuesday, 14th October 2025, Bill second reading, the Public Service Bill 2025. Motions, motion of adjournment. Wednesday, 15th October 2025, Bill second reading, the Public Service Bill 2025. Debate commences and continues. Motions, motion of adjournment. Thursday, 16th October 2025, Bill second reading, the Public Service Bill 2025. Debate continues and concludes. Friday, 15th October 2025, motion of adjournment.
Bills first reading, the Public Service Bill 2025.
Honourable members, the Public Service Bill 2025 is now deemed to be set down for second reading. Honourable members, that concludes our business for today. Honourable Prime Minister.
Thank you, Mr. Speaker. Sir, I move that Parliament do now adjourn.
Thank you, honourable members. The question is that Parliament do now adjourn. All those in favour, say aye. Aye. Against, say no. I think the ayes have it. The ayes have it. This House is now adjourned until 9:30 a.m. on Tuesday, 14th of October 2025.